and we co-evolved with plants. I mean, the stuff that they produce, we have receptors for that in our body, so that make total sense that we get all of this health benefit from the plants, because like we share many biological pathways, receptors, and like similar molecules. That's why they are helpful.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by Dr. Shabnam Sarshar, who is a herbal specialist and recently got nominated as one of the 15 influential women in the cannabis industry. She is absolutely fantastic, but without further ado, I will hand over to Shabnam. Hi.
Hi, Berta. Thank you so much for having me on the podcast. I mean, we had this talk about cannabis and herbal medicine before, so I'm super happy to be here. Uh, okay, you asked me to make a short introduction. So I'm Shabnam, originally from Iran. Since I remember, I studied herbal medicine and phytopharmacology, which is basically the pharmacology of medicinal plants, why they do work on our body, what kind of specific chemicals in one plants are responsible for the effect that they have, and so on and so forth. The huge proportion of my study was in Iran because, like, as you know, Iran has also a long history of herbal medicine, so Persian traditional medicine. And for my PhD, I moved to Germany, and actually, that was the very beginning why I got interested in women health. After 28 years, you have to imagine that after 28 years of my life, I started to make some questions. Okay, why something are happen to us during the menstrual cycle? For example, why we have more urinary tract infection before our menstrual cycle? And that was the point that shifted basically my interest from general, like, herbal preparation to herbal preparation which are specific for women.
Honestly, Shabnam, that is just absolutely amazing. I mean, personally, I think I've mentioned to you on several occasions, I am an absolute huge fan of your work. I think often people forget that medical cannabis itself is a plant. It is a botanical rather than pharmaceutical. And I suppose that's where you come into it because you do deal with a lot of plant medicine and not just in terms of what we commonly know as cannabis and psychedelics, but actually the herbs and how that actually contributes to health. I, like yourself, I'm African descent, and within our culture, we generally try to treat everything with herbal medicine first, and then if herbal medicine doesn't work, then we will go into pharmacological sort of intervention. But just while we're talking about it, then I'm just going to hand the floor over to you because I know you have an amazing presentation for us. So I'm going to keep my mouth zipped and I'm going to hand it back over to you. But yes, thank you for being on. And yes, if you can let us know a lot more about herbal medicine and how this also contributes to women's health. Obviously, women's health is something that is not really recognized. I know more and more it is being acknowledged as its own sort of field of medicine. Um, However, there is still a lot of work that we need to do in this area. Okay, I'm going to shut up now and I'm going to hand back to you.
So okay, I mean, as I said, for me, so first of all, I have to say it's a shame. It's a shame that we as women don't get this education about our about this important phase of our of life. I mean, when we start to get menstruating and we when we stop menstruating, these are two pivotal transitional phases in our life that we get zero to no. I mean, around no education around that. Okay, so I mean. And if you think of the profound effect of this hormonal balance, of these changes, on our psyche, physical, emotional, mental capacity, even how we taste and perceive different tastes. Like it's just sad. It's very sad that we don't get proper education around that. And yeah, luckily nowadays we hear more about this topic, menstruation. Luckily we are talking more openly about menopause. And all of these stuff that are happening to woman's body, they are not modern things. They are like evolutionary ancient uh, process in our body each month, being prepared for pregnancy, being prepared to have a creature in our body. And that's how intelligent basically our body is, that every month make a complete renewal, make ourselves ready for a pregnancy. Because actually, like, uh, survival and reproduction are the main goals of nature. Nature wants us to survive and nature wants us to thrive. So that's exactly what happens in female body months after months. And if I now come to you and say, hey, Berta, you're gonna go through, you're gonna have 450 journeys in your life, and each journey will bring a set of uh, special experiences, which gonna which have an indirect impact on your emotions, on your physical capacity, mental capacity. And basically these changes shape what you feel, what you think, what you taste. You like it or not, you have to have these 450 journeys. And if I tell you, you have the key inside you to make best of those journeys, that experience each of those journeys with grace and knowledge, will you just walk away? I think nobody would walk away. Everyone want to understand. Yeah, okay. If I'm gonna to repeat something 450 times in my life, I want to know how to master it. I want to really know how to how to use it to my advantage. And that's actually our period, at the number of period and the menstrual cycle. That's, yeah, more or less we're gonna face. And I already had maybe 350 of them in complete ignorance. And now I'm starting to listen to my body. Now I start to find out, yeah, okay, all of these changes has a underlying reason. And once you understand this reason, you know yourself anew. You kind of start to bind yourself in a very different way. I don't know how to like explain it, because it's something that you should really experience by yourself. But what I can tell, I can guarantee that this kind of understanding, this kind of bonding with yourself, like, change your mental and physical well-being drastically in a positive way, of course. So yeah, sorry, I just like that was a very long introduction to talking about herbs. And since ancient times, our ancestors, the ladies, have that, like midwives. That's were their job. They were the healers of the family. They selected plants. They did remedies for their use and their use of the family. So that's why, basically, the art of healing, the art of herbal healing, is some kind of intrinsic in us, and intuitionally we know that. I have the feeling that in modern society and in modern days, we kind of, the intuition is still there, but we forgot how to listen to that. So that's why herbal medicine play a huge role to our, like, again, I always say mental and physical health, well-being, because you cannot separate them. I mean, I really love this sentence from Gabor Mata. I don't know in which book was that, but anyhow, the like the essence of what he says is that, yeah, we are telling that our nervous system, cardiovascular system, blood pressure, like gut brain axis, they are connected together. They are not connected together. They are a whole system. It's one system. And once we understand that, and once we use the plants, which we co-evolve together, so that's many people ask why plants work. I mean, with a skeptical way. First of all, we have to know most of the modern pharmaceuticals that we are using, they started to they started to be isolated and synthesized from plants molecules, and we co-evolved with plants. I mean, the stuff that they produce, we have receptors for that in our body, so that make total sense that we get all of this health benefit from the plants, because like we share many biological pathways, receptors, and like similar molecules. That's why they are helpful. So yeah, again, I'm just like jumping from this topic to another topic. I hope you can find a nice cut and nice story to that. And yeah, okay, that's why the herbal medicine works. That's why the herbal medicine can help us help us um, maintain our health before we need to, before we get to a place that we need to treat symptoms with pharmaceutical. So that's I think that's the magic in how, when we take our health in our hand. I mean, of course, like pharmaceuticals, modern medicine is a miracle, but they are more focused on treating symptom. But what happens if we focus on preventing something to happen? But at the end, both of them, they go hand in hand. It's a toolbox that we have to take I mean, we have to have access to this broad toolbox. And yeah, there is, yeah, now we can just, yeah, you shoot me questions.
No, I was only going to say you touched on a key point that I always like to scream and shout about, which is preventative care. I think that, like you said, the healthcare system is set up to treat you once you've reached a point where you're so ill that you can barely function in life anymore. And the reality should be preventative care. Let's do all of the stuff that we need to do for ourselves before we've reached that point. And I know, so for myself on a regular basis, because I do struggle with chronic pain and extreme exhaustion, just so many other symptoms, yeah. But one of the things that helps me boost energy is ashwagandha, which is yeah. So I use ashwagandha like there is no tomorrow. It wakes you up. I feel even when I don't have it, I just feel so much weaker. And I know that I can be on and off with my herbs. So I have everything. And sometimes I have, because I'm ADHD, I will have a month where I am so good with taking all of my herbs and making sure that I cook with garlic and turmeric and, and then there's other times where I'm just like, I don't want to do anything. And I noticed a huge difference in my body, the huge difference in my energy levels, the huge difference in my sleep. And I think that a lot of people do not really understand or value the benefits of food, herbs, spices, all of these can make such a huge difference to your well being and can be used as preventative care. I'm somebody who's prone to tumors as well, and I use a lot of selenium. And since using a lot of selenium, they're very, it's Brazilian nuts would be the best place to get selenium. And since introducing a lot of Brazilian nuts into my diet and stuff that sometimes even more of the supplements as well, selenium. I've noticed that, I've got a few tumors, like benign, don't worry, but I've noticed the growths are no longer growing. It's no longer really impacting me in the same way. Every now and then you do hear it clicking and you feel it clicking and stuff like that. But I notice it doesn't impact me in the same way as it did before when I wasn't using any of these herbs. And these are just herbs I'm talking about, guys. These are just supplements that are found in food, not even a medication or anything.
I mean, you said something super, like super important, because we all heard this saying that you are what you eat. And again, that's the sentence from Einstein, that the doctor of the future is the one who just prevents the diseases, by balancing the diet and the food intake. And that's exactly that, in the very, very simple sense. We are a bag of chemicals. We are a bag of chemicals. And when these chemicals are up and down and they are not in balance, that's why diseases and diseases happen in our body. And, unfortunately, like lots of our modern diet is just shoveling something without thinking about it in our body, because we don't have time. We eat unconsciously. We just want to be full. We just want to get some kind of energy from some sources. And you know of course, like if you want something so fast and just for just for shut off your hunger, it's like I always say, it's like a powder coffee. So which one is better? If you make a super nice with care, a cup of super nice espresso for yourself, or you just want to put at this instant coffee powder. So and the yeah, another thing that's we are talking about this, you see now everywhere, is like the notion of coffee to go, and all of us buy to go in a way to work, or when we are outside. But you never see coffee not to go. I mean, come on, we have these 3 minutes or 5 minutes to sit somewhere and enjoy our cup of coffee or enjoy our meal. That was a couple of years ago. Once I had, I think, 10 minutes between one meeting to the other, and it was like middle of the day. I was super hungry. Berta, I found myself like eating seriously, eating like an animal, like this off my sink in kitchen. And then if then I started to think after, okay, how disrespectful I'm to myself, and how I can expect other to respect me. And all of this stress that you give to your body, all of this unkindness that we give to our body, of course, she gonna tell, okay, no, I'm too tired, I don't want to cope with that. And again, all of our diseases are the stuff that we unconsciously make for ourselves.
Yeah. And you know what? It's funny that you mentioned that, because I think, we live in a society where it's very hustle bustle. Life is very on the go, on the go. And I know, I'm not going to go too much, because I was going to say I blame capitalism, but now I'm just going into politics, so I'll stop there. But the point is, though, that we do live in a world where everything is very hustle bustle, and I've been like you. I found myself, doing quite similar. I mean, I remember there was a time I was trying to make a sandwich, and as I'm making the sandwich, I'm eating the ingredients of the sandwich as I'm making, because I was so hungry I couldn't even wait for myself to finish making the sandwich. And I just thought, like, what kind of life is this? This is not healthy. It's not a good way of taking care of your health. And in particular, when we're talking about, patients and patient care, I think people, as patients, we do often neglect all of the other stuff that we need to do to take care of ourselves. I mean, I have said it before on this podcast where, you know, as a patient, before you get to a point where your health, and I'm talking about chronic illnesses, that includes whether it's mental or physical, before you get to a point where your health is finally managed, you would have gone through two, sometimes 3 4 years of just adjusting medication, adjusting your lifestyle, putting your whole life on hold, really, just so that you can sort of like be stable in your health. And once you stabilize, you no longer want to do anything because you're so tired. But if anything, that is the point where you now that you're stable, do everything else. Make sure you do some exercise. For me, it's mostly yoga. Make sure that you have a good diet. I try to make sure that I'm at least cooking food on a regular basis rather than ordering takeaway. And I would even prepare food in advance so that I can avoid getting takeaway. And when I say food, like, your diet is so important. Like I mentioned to you, I cook with a lot of turmeric. I cook with a lot of garlic, ginger. These are all anti-inflammatories. I struggle with inflammation and pain, and a lot of other. So all of these things need to be in your diet because they also contribute to the, the reduction of disease, the reduction of inflammation and pain. And I'm just listing a few examples. I have such a long list of over there. But the point is that this side should not be neglected because this is what's going to maintain stability in the long run. Because up until I had COVID, yeah, and long COVID destroyed my health and progressed everything to the next stage. It had taken me about, maybe I'd say about 3 years to stabilize because I started experiencing symptoms at the age of 22. I've got several diagnoses, blah blah blah. But by the time I had so many surgeries, yada yada yada. But by the time I got to 27 is when I finally was able to stabilize my health, and a lot of that was because of all the diet that I had. And back then I was able to go to the gym, so I would lift weights. I would, go on the treadmill, swim, yoga, diet. It's a combination of everything that contributes to your health. It's not just medicine, and I think this is where herbal medicine is very very important. And in terms of women's health, sorry, now I'm ranting, but in terms of women's health, this is my last point. I think this is even more crucial because as a woman, obviously, I have my periods and everything every month, and one of the things that even if I'm having a very very good month, the minute I start getting to the PMS just before your period, yeah, it induces a flare up. So people obviously nobody wants to talk about these things. I'm going to talk about it, but these are things that impact us as well. So then I start to use stuff like evening primrose, yeah, because that really helps with managing the flare up. So when I start to feel like, oh, my period is about to come, oh, I'm starting to get the flare up, evening primrose, like so. Yeah, anyways, the point I'm trying to make is that it is very, very important to make sure you introduce a lot of these, a herbal approach and a holistic approach to your healthcare. And as women, it's really important that we recognize that the hormonal changes that take place in our body also impact on our physical health and well being. Sorry.
No, 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 no. Go ahead. I mean, really, I mean, what you said about like hormonal changes, it has a huge impact. And like, Berta, you talked about introducing anti-inflammatory herbs to your diet. So let be clear. Most most of the problems that we have, it's because of the inflammation in our body. We get depression because the inflammation level is so high. We get pain because the inflammation is so high. We got severe PMS again because the inflammation is so high. And if we have a good anti-inflammatory diet, and if we try to at least avoid pro-inflammatory processed food, and it make a huge difference. Like, again, you told me that you add curcuma to your diet. There is a new clinical study that curcumin, I mean, the like active ingredients of curcuma was as effective as escitalopram in major depressive disorder. How crazy is that? Because you know that there's now like a new field of research that how mental disorders are connected to the inflammation in our body. Because if our body is full of inflammation, this this inflammatory pro-inflammatory signals and chemicals can pass the blood-brain barrier, and that, and we have to talk about this. We have to talk about this loudly. Like, before you label yourself depressed, before you label yourself, before you see the whole world around you gray, first recognize in which phase of your life you are, in which phase of cycle you are. What have you been eating last week? Maybe just by pointing out these 3 points, you can already feel better.
Yeah, and I fully agree with you. So on that note, just so that we can start wrapping it up, then, what sort of advice would you give to patients that are and others? I think I forgot to mention earlier. Shabnam lives in Germany. Germany has, I know, has had some revolutionary changes when it comes to medical cannabis and recreational use there. I know that there's some limitations, but I mean, for Germany, I'm impressed. You too, yeah. But I suppose sort of like lending from your experience there in Germany and the sort of contributions that herbal medicine has made towards the German cannabis market. What sort of advice would you give, I guess, to the UK industry for to support patients, and also no, we'll start with the first one for the UK industry to support patients.
Berta, I think for a big because when we talk about using a herb as if you want to introduce a herb for basically well-being or feeling better, is different from using it medically. Okay, I deeply believe that if we are talking about medicinal cannabis and medication, that's why I also really communicate a lot in Germany, and I think it's like a global thing for all the medical cannabis industries, like whoever want to work in this space, is that medication is something that should be standardized. Medical is something that should have evidence behind it. Okay, so uh, medical cannabis industry should invest more in research and development, should invest more in like applications, especially application for women, because again, women endocannabinoid system. I mean, we haven't had we still haven't talked about like cannabis and why that works. Like, but I assume that every one of your audience they already know endocannabinoid system. So male and female endocannabinoid system, they are different. Woman needs different kind of application forms and dosage. That's my uh, basically my wish, my beg, my whatever you want to call it, to medical cannabis industry, that hey, please put a little bit of a budget investment in developing application form, a standardized forms, a standardized procedure that's for medication. Because again, it's medication is different from when you're taking a herb on your dietary supplement for well-being. So that's what I. Well, I hope they listen.
No, no, I fully agree. I am currently screaming about treatment models, and I'm forever screaming about them. So no, I 100% agree. You know, at the end of the day, it is medication. There should be more guidance around it, and I agree. We definitely need to invest in more research, and also as patients, we need to contribute more to research as well, and evidence how this medication is benefiting us. I know in the UK, the biggest research project is, I think it's called Project 21, T21. Yeah, and as patients, it's not just about the fact that you get discounts and stuff on your medication. I think the main thing that we need to focus on is sharing our experience, because it's, you know, we can. It's all right for all of us to say, yeah, let's do research. Research on who? If no patients are going to speak up, like, so patients, we need to take the lead and speak up about our experience, whether it was positive or negative, because we also want to know about the negative experiences, because this will help guide us into, I suppose, what not to do. Yeah.
Yeah, yeah, absolutely. Like at the end, I think the citizen science is the most valid science that we can like gather information, because even if you are doing a RCT trial, you have a lot of inclusion and exclusion criteria that doesn't apply to the real world. So again, the information that you gather from the real world, that's what help other people to understand and to find themselves in those case reports and case studies. Because probably I have a very different I don't know, very different dietary intake from a man who lives I don't know, in an industrial atmosphere, is a CEO. So the way that cannabis medication might work on him maybe that doesn't work on me. So it's really interesting to talk about these different, as you said, patients, patients who are taking cannabis medication for like chronic pain, sleep disorder, or any other symptoms. They should talk about this. Non-patients who are taking cannabis for well-being or kind of to boosting their endocannabinoid system or adding something to balance their life, they also should come and talk about this. It's like, yeah, there is not nothing criminalized, nothing illegal with the herb. It's the way that we use it, is the way that our relation to that plant is making everything. So yeah, I love the idea. More direct talks, more patient forums, more adult use forums. Just like I think. I mean, probably we definitely also talked about this. Like I think a couple of days ago. That like the sense of community. We shouldn't always. Yeah, come really.
No, no, I 100% agree. A sense of community is actually so important to people's well-being, and this is why I always say a holistic approach is something that is needed. And yeah, no, we're gonna go into a whole different topic, so I'm gonna leave it there. But yeah, and so just before we go, then there are, I think in the UK, there are a number of people that have considered going on a prescription. However, cannabis naive patients can be very nervous, yeah, nervous to sort of like engage in I suppose just medical cannabis prescription and the whole process, mainly just because it is cannabis. And just from, I suppose, a if we're going back to the roots, it is a herb, right? So from a herb's point of view, well, it's more botanical, but you know what I mean. What sort of advice would you give to these patients around trying a new medication?
First of all, yeah, congratulations if you decide to try cannabis like as a tool in your toolbox, because it's gonna definitely gonna help you. And if you have some kind of, if you are still have this hurdle, or still feel shame to talk with your physician or your doctor about it, please don't be. Like, please don't be, because it's your health, is your body. It's better to you have to speak up for yourself. And there are many other patients out there that they can help you to start a conversation with your physician. So please ask them how did they start. Maybe they went through the same experience than you. And understand that you are introducing a healing herb to your body. Like, forget about all of the stigma and propaganda about cannabis. Of course, like, even if you drink a lot of water, that's going to harm your body. I mean, I always say, because that case also happened in UK. There was a lady, like young lady, I think 18 years old. She was that it happens, I think 2018. I cannot remember. But anyhow, she wanted to try MDMA for her 18th birthday. The poor girl, she took that, and suddenly she got too overwhelmed because of the effect, and started to drink a lot of water, because she thought if she like drink a lot of water, the body, the drug would be eliminated soon. No, please, everyone out there, each drug has a certain lifetime in your body. Drinking much more water won't change that a lot. So the poor girl drink a lot of water. So at the end, the concentration of the sodium ions was so low in her blood. So she got a brain stroke, and she died, not because of MDMA, but because of the water. So that's what I'm saying. Like, education about a drug is everything. And the, the plants, the drugs by themselves, they are not something that you should be afraid of. The ignorance and not knowing what you want from that drug and how you are going to use it, that is what you should be afraid of. So please educate yourself before introducing anything to your body. And please, please find the open, knowledgeable physician that can help you through that, because again, you are introducing something, a new chemical to the whole chemistry of your body, which in 80% or more, 95% of the cases, it's going to help. It's going to help you. It's going to give a nice balance to all the chemicals that you have.
Shabnam, that was absolutely fantastic. And I think I'm going to end it there. Leave something with people to think about. Shab, thank you so much for coming on here and for sharing your expertise. It was absolutely just wow, breathtaking. I love herbal medicine, so I'm just in awe of you right now. But thank you so much. Um, and for anybody that is interested in following Shabnam's work, her links will be in the description. And we look forward to seeing you guys next week, where we will be exploring some patient experiences. Shabnam, thanks again for joining.
Thank you so much, Berta.
Thanks all. Bye.